Good morning, respected chairperson, faculty members, colleagues, and dear friends. Today, I will be speaking on artificial intelligence in radiology, a technology that is rapidly transforming medical imaging across the world. In this presentation, we will explore how AI works, its current applications, its limitations, and why it should be viewed as a partner rather than a replacement for radiologists. Let us begin by understanding what artificial intelligence actually means and why radiology has become one of the most important specialties for AI implementation. Artificial intelligence, or AI, refers to computer systems capable of performing tasks that normally require human intelligence. In radiology, this mainly involves recognizing patterns in medical images. AI includes machine learning, where computers learn from examples, and deep learning, which uses multiple layers of artificial neural networks to analyze complex imaging data. Another important field is computer vision, which enables computers to interpret X-rays, CT scans, MRI, and ultrasound images. One important point to remember is that AI does not think like a doctor. It identifies patterns and calculates probabilities based on previously learned data. Therefore, AI should always be considered a powerful assistant, not an independent decision maker. Now that we understand what artificial intelligence is, the next question is, why has radiology become one of the leading specialties for AI implementation? The answer lies in the nature of radiology itself. Among all medical specialties, radiology is perhaps the most suitable for AI. Our specialty is entirely image-based. Hospitals already store millions of digital images through PACS. These large datasets are ideal for training AI models. At the same time, imaging volume continue to increase every year, while the number of radiologists has not grown proportionately. AI helps reduce this workload by automatically detecting abnormalities, performing measurements, and prioritizing emergency cases such as intracranial hemorrhage or pulmonary embolism. This allows radiologists to focus first on the most clinical patients. Thus, AI is not being adopted in radiology simply because it is a technological trend. It is being adopted because radiology possesses the ideal combination of large digital datasets, image-based workflows, and growing clinical demand. Let us now understand how AI actually works in medical imaging. First, medical images are collected. Expert radiologists manually label these images, for example, outlining lung nodules or identifying fractures. These labeled images are then used to train deep learning algorithms. Once training is complete, AI can analyze new patient images and identify suspicious findings, measure lesions, and assign probability scores. However, the AI output is always reviewed by the radiologist before the final report is issued. Therefore, AI functions as a highly efficient assistant that can rapidly analyze large amounts of imaging data while the radiologist provides clinical judgment and accountability. Let us now look at where AI is currently being used in routine radiology practice. One of the most common applications is chest imaging. AI algorithm can assist in detecting lung nodules, pneumonia, tuberculosis-related abnormalities, pleural effusion, and pneumothorax. In neuroimaging, AI can rapidly identify intracranial hemorrhage, large vessel occlusion, ischemic stroke, and brain tumors. Breast imaging in another major area, AI can support mammography interpretation by identifying suspicious lesions and helping prioritize cases that require closer evaluation. In neuromuscular radiology, AI assists in fracture detection and bone age assessment. In oncology, AI can automatically segment tumors, calculate lesion volumes, track disease progression, and evaluate treatment response over time. Cardiac imaging is also benefiting from AI through automated measurements, coronary calcium scoring, and assessment of cardiac function. Before discussing advanced application, let us first understand why AI is particularly important for India. India faces a unique healthcare challenge. We have a population of over 1.4 billion people, but the number of radiologists is relatively limited, especially in rural and semi-urban regions. Government hospitals often experience heavy patient loads and delayed reporting. AI can help bridge this gap by rapidly screening medical images, helping identify potentially abnormal studies within seconds. It can support early disease detection, prioritize emergency cases, and reduce the reporting workload of radiologists. Another challenge is the increasing demand for teleradiology services, where a small number of radiologists may be responsible for reporting studies from multiple centers across different geographic locations. This is where artificial intelligence can make a meaningful impact. In the Indian context, AI has the potential to make radiology services faster, smarter, and more accessible to millions of patients. One of the most successful and practical examples of AI implementation in India is tuberculosis screening using chest X-rays. Tuberculosis remains a major public health challenge in India. Despite significant efforts under the National Tuberculosis Elimination Program, millions of people still require screening every year, particularly in rural and resource-limited settings. Traditionally, chest X-rays are interpreted by radiologists. However, in many areas, radiologists may not be immediately available, causing delays in diagnosis. For tuberculosis, AI-based screening on digital chest X-ray flags suspected cases within seconds. This allows for rapid trials in community health camps and mobile units, helping to ensure timely confirmatory testing and treatment. While AI is helping in population-level screening for tuberculosis, it is also transforming emergency. Let us now look at the role of AI in stroke diagnosis and management. In emergency stroke care, every minute counts. AI identifies critical findings like intracranial hemorrhage or large vessel occlusion, immediately alerting the stroke team to reduce the time to life-saving treatment. For example, if a patient with an acute stroke undergoes a CT scan at midnight in a district hospital, AI can rapidly flag suspicious findings and alert the stroke team even before the final report is completed. This can significantly reduce door-to-needle time for thrombolysis and improve the chances for neurological recovery. AI is also proving valuable in telestroke networks, where imaging performed in smaller hospitals can be quickly analyzed and shared with specialists located in tertiary care centers. In a country like India, where specialist resources are unevenly distributed, AI has the potential to improve stroke care, especially in Tier 2 and Tier 3 cities. After stroke care, another area where AI is creating tremendous value in is trauma and emergency imaging, particularly in road traffic accidents and emergency department. Let us look at this next. India, unfortunately, has one of the highest numbers of road traffic accidents in the world. Every day, emergency departments receive patients with head injuries, chest trauma, abdominal injuries, and multiple fractures. In trauma cases, rapid diagnosis is critical because delays can directly affect survival. AI system can rapidly analyze imaging studies and identify potentially life-threatening findings such as intracranial hemorrhage, skull fractures, pneumothorax, rib fractures, lung contusions, internal bleeding, spinal fractures. When such abnormalities are detected, AI can automatically flag the scan as high priority and alert the radiologist. This supports triage in busy emergency departments, helping radiologists manage high volumes and focus on the most critical patients. Beyond emergency care, AI is also playing an increasingly important role in cancer detection, particularly lung cancer screening using chest CT scans. Lung cancer is one of the leading causes of cancer-related deaths worldwide and is increasingly becoming a significant healthcare burden in India. One of the biggest challenges in lung cancer management is that many patients are diagnosed at an advanced stage when treatment options become limited and survival rates decreases significantly. The key to improving outcome is early detection. This is where AI can play a transformative role. AI aids in lung cancer screening by acting as a second reader to detect small nodules on CT scan. This supports early detection, which is vital for improving long-term survival rates in high-risk populations. Beyond simple detection, AI can also measure nodule size automatically, compare growth over time, assess risk characteristics, prioritizes suspicious cases for review. AI can identify findings such as pulmonary nodules, ground glass opacities, speculated lesions, emphysematous changes, and pleural abnormalities. This allows radiologists to focus on cases that require urgent attention. While lung cancer screening focuses on early cancer detection, another area where AI is creating a major impact is breast cancer screening through mammography. Let us look. In breast cancer screening, AI improves detection consistency by identifying subtle masses or calcification in mammograms. Combined with teleradiology, this technology can expand access to high-quality breast cancer screening across the country. Modern AI systems can analyze mammograms within seconds and identify suspicious findings such as breast masses, microcalcification, architectural distortion, asymmetry, suspicious lymph nodes. The AI highlights areas of concern and assigns a risk score, helping radiologists focus their attention on potentially significant abnormalities. Let us now explore how AI is helping radiologists manage increasing workloads through workflow optimization and automated reporting. Until now, we have discussed how AI helps detect diseases such as tuberculosis, stroke, trauma, and cancer. However, one of the most important and immediately practical application of AI is not disease detection alone. It is workflow optimization and reporting efficiently. Today, radiology faces an unprecedented workload. A modern radiologist may need to review hundreds of X-rays, CT scans, MRIs, and ultrasound every day. In teleradiology services, especially during night shift, the workload can become even greater. This creates several challenges: reporting delays, reporting backlog, fatigue and burnout, variability in reporting styles, less time for complex clinical decision making. This is where AI can significantly improve workflow. Let us look at the typical workflow. First, an imaging study is performed. AI can automatically analyze the study and identify potentially urgent findings. This process is known as AI-based triage and prioritization. Next, AI can perform several routine tasks automatically. It can measure lesion size, calculate tumor volume, compare current and previous studies, label anatomical structures, generate structured measurement. These are repetitive but time-consuming tasks that traditionally require manual effort. AI can also assist in creating draft reports using structured templates and natural language processing. AI can generate preliminary report text based on detected findings. The radiologist then reviews, edits, validates, and finalizes the report. This allows radiologists to spend less time on repetitive documentation. This efficiency helps reduce radiologist fatigue, allows more time to focus on complex cases and direct patient care. After discussing the many benefits of artificial intelligence in radiology, it is equally important to understand its limitations. AI is a powerful tool, but it's not perfect. Like any medical technology, AI has strengths and weaknesses. One major limitation is false positives. Sometimes AI may identify a normal structure as abnormal. This can lead to unnecessary investigation, increased costs, and patient anxiety. Another concern is false negatives, where AI fails to identify a significant abnormality. In such situation, relying solely on AI could delay diagnosis and treatment. This is why human oversight remains essential. Another challenge is data bias. AI systems learn from the data used during training. If the training data does not adequately represent different population, age groups, ethnicities, and disease patterns, the AI may perform less accurately in real-world settings. This is particularly relevant in India, where disease patterns and patient demographics may differ from datasets used in Western countries. AI performance may also be affected by poor image quality, motion artifacts, incomplete studies, rare diseases, unusual anatomical variations, and post-operative changes. Another important issue is the so-called black box problem. Many AI systems provide an answer but do not clearly explain how they reach that conclusion. For example, AI may flag a lesion as suspicious, but understanding the reasoning behind the prediction may not always be straightforward. This creates challenges in trust, transparency, and accountability. There are also important ethical concerns. We must ask who is responsible if AI makes an error. Who owns the patient data used to train AI? How can patient privacy be protected? How do we ensure fairness and avoid bias? In addition, cybersecurity becomes increasingly important as healthcare systems become more digital and interconnected. Another risk is automation bias. This occurs when clinicians begin to trust AI recommendations without independent verification. The greatest danger is not AI making mistakes. The greatest danger is humans accepting those mistakes without questioning them. Therefore, AI should always function as a decision support system rather than an autonomous decision maker. The radiologists remain responsible for interpretation, clinical correlation, and final reporting. The failure of radiology is not about replacing human expertise, it is about combining the strengths of AI, human intelligence to provide safer and better patient care. AI can assist radiologists, but accountability, clinical judgment, and responsibility always remain with healthcare professionals. Having understood both the strength and limitation of AI, the next question naturally arises. Will AI eventually replace radiologists? The short answer is no. AI will not replace radiologists. It will augment their capabilities. The future belongs to radiologists who embrace AI as a partner, combining human clinical judgment with the speed and consistency of machine intelligence. In conclusion, AI is transforming radiology by enhancing efficiency, improving patient outcomes. Together, by using AI wisely, we can build a smarter, more accessible future for healthcare in India. I would like to conclude with this thought. Artificial intelligence will not replace radiologists, but radiologists who embrace artificial intelligence will help shape the future of healthcare. Thank you.